be able to listen. You cannot project what you've learned from the books or from the studies and put that over a patient like an envelope or like an umbrella. This is not how medicine will work. I'm German by birth and passport. I'm 72 years old. And I'm a physician since 47 years. My mother was a nurse, community nurse, and I was always interested in what she is doing. I can think back to year 4 or 5 when I was allowed to accompany her to go and visit her patients. And the desire to become a medical doctor was developed early on, and I never gave it up. I'm a Gemini, and one of the characteristics of those people is that they have to have new projects all the time. And this is how I probably see myself. If a project is done, somebody else must run it because my interest shifts to another place. But I must say, with regard to medicine, there's so much to learn that one lifetime is not enough. I have never abandoned medicine as a project. That had importance throughout my life and still does. Oncological patients with metastatic disease do not tend to be your patients for a long time. Treated with conventional medicine or even with complementary methods, their life expectancy is usually very short. And as a young physician, you see what other doctors do, what other oncologists do, what other intensive care doctors do, what other immunologists do with cancer patients. And I asked myself very early on, there must be something else than having to observe this for the rest of my life, that patients come, I see them for 6 months, and then they are dead. There must be something else. So I started traveling to many so-called alternative oncology clinics to get impressions, to know what drives them and what is so different to conventional medicine and conventional oncology. I was on a quest to find ways to make it better or to provide more to a stage 4 cancer patient. I think a striking difference was that the patients that I saw in those clinics that I visited, they looked different than our patients at the university hospital. They were not as sick appearing. They were not depressed. Their suffering was different. They had less side effects than our patients from toxic treatment. They did not all take toxic treatment, but those who did, they had less severe side effects of the chemotherapy or of the radiation treatment. And I learned quickly, it is actually real. You can tune down the side effects of chemotherapy. You can make those patients who want to combine conventional treatment with the holistic or integrative or what it was called alternative oncology methods. You can combine it in the favor of the patient. And the result is not only reduced side effects of the toxic treatments, it is in many cases a synergistic efficacy effect. That means the supplements that are used to reduce side effects at the same time can have a synergistic effect with the chemotherapy, improving the patient's treatment effects, improving the outcome. And that was the most impressive finding for me. In the end, as I mentioned earlier, the concert of all of these efforts within holistic treatment have the same goal: to improve quality of life for stage 4 cancer patients, and to also prolong their life in a meaningful way. It is not important to gain time without life, but it's much more important to gain life and time. Well, there's two things that they will tell us regularly, and that is, it's so easy to follow your program because it has very limited side effects. It's comfortable because it can be done at home. Physician visits are not really required because the supplements and medications that we use have a broad therapeutic window, meaning the side effects are very low, and side effects will only come if you heavily overdose. So it's a rather safe and convenient protocol that patients can follow. Nevertheless, we are in contact with all of our patients through Zoom and Skype conferences, and also with their physicians. I usually recommend that physician supervision should be available for all of our patients that use the protocol. From the very beginning of our work was like this, that we always try to hook up with the primary physicians ourselves. That means the patient should not have the feeling to be sitting between two chairs. I think integrative medicine has a future, and I like to believe that. It will be driven by demand from patients. It's not something that you can decide on a governmental level that each university should have a department like this. And it's not up to the dean of the university to decide. It will be patient-driven. Patients with cancer, stage 4, will be more and more if we look at the present statistics of 20 million new cases worldwide per year, and 1 in 2 people will get cancer in their lifetime. The traditional way of dealing with that cancer epidemic is not going to be enough. Patients will demand a holistic and integrative approach. They will see the advantages and benefits such approach will have.